Good evening, beautiful people. On behalf of the TBL family, I welcome you all to our Facebook Live on Conquering COVID with Positivity and Awareness. As you all know, the world is battling with COVID. TBL has come about to bring in a live session on how to conquer COVID with positivity and awareness. TBL is a knowledge exchanging, knowledge sharing, and learning and networking platform enriching the lives and businesses of entrepreneurs. Today evening, we have our two esteemed guests, Captain Dharamveer Singh and Dr. Jyoti. Captain Dharamveer Singh, as an ex-army captain, Dharamveer Singh has always believed in maintaining a physically fit body with a mentally fit attitude in all his endeavors. As a Fit India ambassador, he walks his talk through his plasma drive and COVID awareness for saving lives through his nationwide appeal. A runner, mountaineer, rider would like to share his knowledge and views as a survivor to fight COVID with positivity. Dr. Jyoti S. Acharya. Dr. Jyoti is a clinical psychologist with a PhD in psychiatric social work, having served in the COVID cell and still doing a splendid service with helping patients with COVID-related anxiety and helping them through COVID guidelines and protocols, thus bringing awareness and positivity. Dr. Jyoti works relentlessly through various social organizations, helping people, especially women and children, with anxiety and depression and other mental health related issues. A strong believer of no bias should be attached in the form of religion, caste, and academic qualifications in the system. I'd like to present our in-house panelist, Ms. Ekta Bansal, founder and CEO of Parijay Genus. The firm established in 2017 with the vision of bringing people close to nature and promoting the Go Green concept. It focuses on environment and women employment. The goal is to provide living wages and humane working conditions to our artists. Ms. Ekta credits her childhood passion and her zeal to empower women, which gave birth to this green firm. She's been working enthusiastically for this cause since 2016 with the mission Every Corner Needs a Plant, as her aim is the pledge to serve the Mother Earth and Miss. So this is to employ 2 lakh women under the roof of Parijay Genus. Now I introduce Ms. Kanishka Ramchandani. Ms. Kanishka is the founder of WordMonk House of Content. She's an experienced journalist and editor and currently working as a content specialist for PR and Digicom services and a passionate writer. It's time to introduce me. I'm your host for tonight, Seema Sharif. I'm a relationship coach, an effective communications trainer, and a motivational coach. I'd like to handhold people to find solutions to happier, fulfilled relationships, aided with effective communication skills, both at personal and professional level. I do coaching one-to-one under the banner of Euphoria One, and I believe that one must, for the fulfilled life, nurture your being at every stage. So, shall we get on? Firstly, I'd like to ask both Captain and Kanishka, how did you handle the mental stress of having COVID? Can I have your views, Captain?
First of all, thank you so much, Seema and TBL for giving us this opportunity. I have been a firm believer of acceptance of facts around you. You know, it always helps in whichever field, whichever state of life you are. If you accept what it is, it gets easier. But if you live in denial, if you hope against the hope, it gets little difficult. So definitely it's not a good feeling in these tough times to realize that you are one of those who are being talked about. You are one of those who would be represented on a graph on the news every day, positive, suffering, recovered. But I think what helped us, one after another, I think it was me, then my wife, then my daughter. We had this self-belief that good times are there. That is number one. And there are other people in my own society who were pretty much in similar situation, but they panicked. They demanded oxygen, they demanded concentrator and stuff like that. And I realized that their lives were getting much difficult. Another thing that helped me keep calm was the situation outside. So, you get paranoid when the situation in your house is not manageable. And if you go to a hospital, you are better managed. But honestly speaking, that was not the reflection that I got at that point in time. I realized that the hospitals were rather a scary place than being at your own in your own space. And that is something that I kept telling my wife. That is something that I kept telling my daughter. And I remembered something from my army days when the artillery shellings were continuously on your bunker, but you still have to smile in front of your men. You can't tell them that you are afraid and, oh shit, the next bomb should not drop on us and what will happen. So as a leader, you are supposed to tell them that it's fine. Your bunkers are really fine. You have worked hard to create these fortified bunkers for yourself. And believe you me, even if three more shells fall on these bunkers, nothing will happen. So that's the whole idea. That's the whole thing that I had in myself, that self-belief. I think it's a non-tangible aspect of bringing up your family, your children, and it goes on to them the way you look at different issues in your life. And probably my daughter is a true replica of how I think, and she was equally, kind of chilled out about it. Another thing that helped me was I realized that I don't want to uh, look shabby. I don't want to look sick. So I would get up. I would continue with my calls, my social media endeavors. I would continue to talk to people. Uh, I wouldn't use the word helping, but I was doing everything that was possible for me to do for everybody who was in need. And
That.
over a period of time, it became rewarding because I was consumed totally into it. I would spend at least 14 hours of my time into arranging things for others. So if I have to conclude this in one line, I think you have to have self-belief, number one, and you need to keep yourself meaningfully involved in something so that these thoughts of negativity do not kind of kill you from inside. So this is how we handle it. I think Seema, you are mute.
Sorry. Kanishka, would you like to share your experience?
Yes,
Thank you,
Seema, thank
Captain.
you so much. Thank you for organizing this panel discussion today, because I think it's very important that we talk about the effects of positive thinking that COVID patients and everybody associated with this disease needs to have, because the worst part about COVID-19 is that it hits you mentally first. Before you see your symptoms, before you get affected by the illness, it kind of takes a hit on your mental health first. um, I agree with Captain when he said that it's a fear of being one of the statistics that also adds up to all the negativity around it. Be it the statistics of being a positive, or the survivor, all those who got well and went home. Whatever be the statistics, we don't want to be a part of that. In my case, I live in a joint family, so I have a big family, lots of family members. And before the lockdown, half the family was in Dubai, and unfortunately, all of us got affected. So 4 to 5 members here in India, 4 to 5 members in Dubai were simultaneously affected around the same month. So being morally there for your family members was the most difficult thing, because you yourself were battling with the negativity that is COVID-19. It was a very heart wrenching experience for all of us, because each one of us was engulfed with fear, and at the same time we had to look out for each other. I felt that one common thing that we had when it comes to negative thoughts was the thought of death. That was completely undermining. That was what weakened our willpower and spirit. And we did our best to stand up for each other, to support each other. Of course, we had a lot of support from our extended families and friends and neighbors too. And what I realized was it was the positivity that they brought to us that help us sail through it all. Because without all that, if we were just to be left at the hands of TV news channels and WhatsApp messages, then probably our recovery wouldn't have been that easily done. So positivity is a very important factor for battling this disease, especially because it can cause mass hysteria. We have seen it do that even in India. So thinking positively and implementing that in everything that you do when you're caring for yourself or for your family members and friends is very, very important. And yeah, that's about my experience of battling with COVID.
Right. So, would you both believe that you need a support system is very necessary during the crisis that you go through mentally and physically in COVID? So, what kind of a support system do you think is necessary? I'd like to have both the views of Captain and Kanishka. Captain?
So unfortunately, this is really ironical that you're probably going through the toughest phase of your life. And when you think of physical support, I couldn't even touch my daughter for 13 days when she was going through the worst of her life, right? So there isn't much that you can do for a COVID patient physically, but making sure that you are there and making sure that you so it's less of what you feel, it's less of making the other person feel that no matter what, you are there for them. So with time, when you make sure that whether it is your wife, whether it is your children or your parents, if you can give them this feeling with your acts that you are there for them and you will not leave anything on this earth to make sure that they are fine. So I think giving this belief to people you are responsible for is very, very important, because it takes away that burden from them. It's like you stepping out for shopping, leaving your small child home, and before you leaving, someone assures you that, listen, just relax, I'll take care of everything here. उसका खाना टाइम पे दे देंगे, उसका ध्यान रख लेंगे, उसको सुला देंगे. So there are n number of things which act psychologically in our heads. So giving that belief is very, very important, and I think that's the mental support, probably what Kanishka was talking about, and I think that comes from your people around.
Kanishka?
Yes, I totally agree with the captain here. What happens is when you are under quarantine and you are, not able to help anybody physically, you see a new support system emerging, in which people unknown to you or people who are not really in your immediate circle come up, rise to the occasion and help you out. And that finally restores your faith in humanity. And acts of kindness by strangers or, extended family members extended family members or neighbors going that extra mile just for you, for your comfort, for your basic needs, that makes a huge difference. Fortunately for me, my family, especially my husband, has been involved in a lot of social work around COVID-19, and we have been on the other side of the fence, wherein we are providing support to people
Awesome.
who are suffering, who are looking for hospitals and running around for ventilators. So it's a very fulfilling feeling that you get when you are somebody else's support system, even though in perhaps your regular life you may not come across them that
Right.
easily. So these are a few factors that have come up, and that really shows that it's the human spirit that wins, that triumphs, and COVID-19 is just another disease, and we can battle it together.
Absolutely. I'd like to just share a bit of my experience with this. I've had two aunts over the last 1 week who were battling for different reasons, but of course, COVID related. One was battling with mucormycosis. And when you talk of support system, I had only one cousin out here, and all through because of the lockdown. And despite the fact that anyone wants to be there, you can't be there. This is the thing. So the best way that you can offer your support is, as you said, be a volunteer for the COVID war room. Do your bit, what you can, finding the necessary support, what people want, like a bed or oxygen or the right doctor, or connecting to the right people. And I lost another aunt due to pure negligence, but still she had COVID. So the other important thing for awareness, I guess, for people is to get vaccinated. And there's a lot of stipulation along about which vaccine works best and when to get vaccinated, or to get vaccinated or not to get vaccinated. So I guess we can bring about awareness in people. The least bit that we could do to remove that fear of getting vaccinated, remove the fear of what COVID can cause in their life. So I would like to ask Dr. Jyoti, what's your take on anxiety during COVID, and what do you think are your suggestions on how to deal with COVID-related anxiety?
I think first of all, the anxiety is naturally responding your feelings. Otherwise, naturally, think about the stress, frustration, confusion, sad because of the pandemic time. Frequently, you are not meeting anybody. Frequently, you are not meeting your family. So much of the news, then struggling with your known circle, this all can confusing mood, then worried about the situation. This is all the pandemic anxiety.
Right.
Then if we are like thinking how to deal with the anxiety, this is only simple. We can connect with our family, friends, and frequently, whatever the news you are getting, you need to be follow one trustful sources. Like frequently not
Right.
checking newses, frequently not like that's okay to not update. That's fine.
Mhm.
Every day, only once you can update yourself about vaccination, COVID, oxygen, so many things. I think people are worried about the news. I think I got one call about OCD. They are saying, Madam,
Mhm.
the frequently washing hands, how many times we need to follow?
Okay.
This is kind of the stress, anxiety. This is all like
Mm.
small things, are simple things. We need to think about this is general. Even
Right.
like before, also we all doing this, right? If we are
Right.
going out, will come back, we'll change our dress, whatever the basic thing. We need to concentrate how we are connecting with the newses, how we are like thinking about the pandemic. That's fine. Yeah, like the COVID, everything, like the emergency of the bed, oxygen, vaccination, all the stress we have. We can take the break to think about the situation. We need to think about positivity. We need to slightly neglect the negative thoughts. I think,
Right.
yeah, that's all.
See, sometimes, Dr. Jyoti, it's easy to say don't get stressed, and but when a loved one gets affected, much as we try, stress and anxiety do creep in. So, in such a situation, what steps can we take if we are faced with such situation and we are anxious? We are anxious for our loved ones. Like, what would happen, especially with people with comorbidities or if they're immunocompromised? Then the stress levels are high. So, what can we do to beat that anxiety and come emerge with positivity that we can fight it out?
I think that time, the crucial time, we need to be very quick with our mindset or thought process.
Okay.
The crucial time, if we are frustrated, if we are like thinking too much, over like anxious about the process, we need to be very quick with our procedures. We need to connect with the doctors. We need to connect with the like what treatment we can get for them. Okay, then if we are talking about like medically anxious about this pandemic time, we need to write down what specific worries we are having the whole day. We need to write down that. Then we need to think and we need to plan what is the positive possible ways for the situation. We can't be a perfect. We can't be a like controlling any situation. We need to think what we can control. We can control that thing. Otherwise, like overthinking, over thought process, this is all. Then like again, you will become very weak. Then you can't think properly, you can't help who needs to like your support, your emotional support, your like medical support, whatever the thing, you need to be very confidence with need people.
So basically, during COVID, overthinking and overhearing of various information through different sources also adds on to the anxiety. So we need to keep ourselves away from such unwanted information. Is that what you're trying to tell us?
Definitely, we need to understand what we are concentrating,
Yes.
where our
Okay.
energy we are spending.
Right. Right. I got the point. Ekta, I would like to ask you, how have you adopted to the COVID times? Have you had any lifestyle changes due to the pandemic?
Yeah, first of all, thank you, Seema, and thanks to TBL family that we are here together at this platform and discussing about this wonderful session. It's really the need of the hour. So, if I talk about the change in lifestyle, in my case, it's not a very big change. We adopted a few measures. We were already, the very first thought is in my mind is I always believed that everything is in mind. If our mind is healthy, then our body will react accordingly. So we were already doing so many things like related to a sustainable life, like healthy food, growing plants, doing havan, exercising, meditation. Not, I won't say that 100%, but yes, that was part of our life, 70 to 80%. When I come to know that there will be lockdown, I think it was 17th or 18th of March when I come to know, because it's my habit, because I don't watch TV and read the newspaper, because I feel that if we start our day with the newspaper, because papers are full of so many news, like negative news, this and that, so that that creates an effect on our mind.
Right.
So I think this thing helped me. And when I come to know, the very first thing, we were 5 people in my team working together. The first thing we started is start taking the giloy tablets. So using the neem leaves, because we believed, because in our old age traditions, we use neem leaves and this neem leaf water. And I said to all my people that if sanitizer is not available, then just go for the neem leaves, boil it, use that water. So if sanitizer is available, then it's okay. Otherwise, go for the neem leaves, go for the giloy tablets. And luckily, if I tell you, everybody in my team is absolutely fine. They and their family, because
Right.
at that time also I had so many things in my mind that how would we complete our work now, and because this was in terms of a professional front, it was the beginning of my career. So I thought that, oh, what happened? But there was a challenge where everybody says,
Right.
मैम दीदी अब क्या होगा, कैसे रहेंगे, गांव वापस जाना है. So I said, no need to go anywhere, just stay here. We will manage together. If there will be half chapati, we will manage together. So just stay here, stay safe. This is the most important thing. So these things, the willingness and the sustainable life we adopted helped us to go through this. And
So we
also,
all can. We all can. Right.
yes, we all can. And the other thing is, a very important thing I realized in this COVID period is anxiety is not only because of this disease, it's because of fear of staying alone.
Right. Right. A very valid point.
Yes, this fear that how would we stay alone is the fear which is creating problem for all of us. So I also faced this fear, but I took it as a challenge.
Okay.
I did lot of introspection. I involved myself in lot of thinking process, thinking in not the right. It's not like this that what should be the next, how would I survive, and all these things. The thinking was this that how I can progress and how can I help the people around me.
Right.
So instead of looking at the whole world through this virtual media, like social media, as well as through the newspapers or TV newses, I just looked around myself, to my neighbors, to my surroundings, the animals, plants, and I thought that what I can do, what I can do to return. Parijay's vision is already environment and women employment. And this time period helped us to introspect and do a better planning, connecting in a better way with the people, not only the family, friends, relatives, but also to so many other people all over India. So
Wonderful.
this, yeah. So I feel I this 24 hours, even lesser, I need more time to interact.
Right.
So there is no point of anxiety. There is no any, even I have a single second to feel anxious.
Right.
Also
I
healthy
got what
diet.
you're saying.
Yeah.
Right.
Healthy diet,
Uh,
regular exercise, meditation. These are
right.
also the
The
factors.
lifestyle changes that you adopted
Yes.
and made others adopt. So, talking
Yes.
about lifestyle, Captain, as a fitness ambassador, how important is it to remain fit in order to survive COVID, both on the mental and physical level?
I think that's the key somewhere. We're talking about anxiety, we're talking about stress, we're talking about mental health
Right.
around this corona time. Let's understand, are we actually scared of the COVID and we will die? Is that the fear? Or as a father, my fear is what will happen if tomorrow I'm not there? What will happen to my son who is not good for anything? He is physically not active. He's mentally not, capable of taking care of issues. My wife, how would she step out? So your stress is an accumulation of not just the fact that you are, not well. The
Right.
stress and anxiety is primarily what will happen if tomorrow you are not there.
Mm.
Because being social, you care for people around you, right? So if you're not there, that adds up to hell lot of questions and you get stressed and anxious
Right.
about so much. It's not that when the COVID was not there, people were not anxious.
Right.
The reasons were different. Sometimes it's your boyfriend, sometimes it's your girlfriend, sometimes it's your job, sometimes it's your mother and daughter-in-law relationship. Something or the other will keep coming.
Absolutely.
So where fitness helps is, number one, we are all working from home,
Mm.
whatever we are doing. I mean, not everybody is fortunate enough to retain their jobs, but whatever we are doing today is all happening home.
Right.
And the biggest plight is how to use/kill time. Another issue is every second female feels that she is putting on weight because she's got nothing to do and she is only eating. I mean, this is my friend circle. Typically,
Okay.
everybody feels that, there's nothing to do, what to do. People are following diets which are not healthy just because they're
Right.
not physically active,
Right.
right?
Right.
So as a fitness person, I feel it helps me at least 5 ways.
Mhm.
Number one, if you are physically active, as a life coach, as a relationship coach, as a psychiatrist, as a responsible leader for your trust, and as a family member, all of you present here, you would accept that a routine helps anyone cope up with a day better. So the moment
Absolutely.
you are a sports person, there is a routine.
Right.
Everybody wants to utilize the best time of the day for their workout. You would never want to, nobody runs 11 o'clock in the sunlight
Right.
or works out at 11 o'clock in the heat,
Right.
or disturbing the whole equilibrium of the house when someone is doing dishes, someone is doing food, kids are going to the school. So if you are into workout or into fitness, you will typically use that morning hours which is available to you, and that will help you get up timely,
Okay.
and you will follow a routine. To be able to do an exercise for 45 minutes at 7 o'clock in the morning, you'll have to get up at 6. So an hour there, an hour of workout. And when you finish it, that good feeling is contagious,
Absolutely.
right? Every
Absolutely.
human being, you want to talk good about yourself. When you go to a society and you are in a party, we all seek for an opportunity where you can prove that, what you're doing is little better than what everybody else is doing.
Yeah, you need
Whether it is the
validation.
shade of your nail polish, whether it is your sari, whether it is the marks that your kids get in their school, or the sports day achievement of your kids, there is something that you want to talk about which probably gives you a higher pedestal in that society. Imagine if you're a fitness freak and you've been working on yourself and you're following a routine, that automatically gives you a pedestal where nobody else is,
Mhm.
right?
So, how important is it for COVID?
It
When
is
you,
important for COVID because we all are talking about mental health. We all
yes,
are talking about not being able to spend time home. We all are talking about not meaningfully engaging ourselves. We
right,
are all talking about having ailments related to our tummy and entire digestive system where it is giving you anxiousness. Your
right,
digestive system is not fine. And for that gas, in this pandemic, everybody feels that he has COVID now,
hmm, right, right.
because the list of probable
Symptoms,
signs
yes, yes,
are everything. आपके पैर की उंगली में भी दर्द हो रहा है तो कोई डॉक्टर बोल के रखा होगा कि
PCR
प्लीज
करा लो.
visit a doctor, this could be COVID.
Yes,
So the point that I'm trying to drive here is that if you are engaged meaningfully, if you are following a routine, if you're working on your fitness, if you get hungry and eat what you want to eat, it negates the possibility of you eating junk or a diet which is not healthy.
yes,
So all of this put together, first of all, it kills or utilizes at least 4 to 5 hours in a day.
right,
It gives you a better sleep. If I'm tired, I'll sleep better. If you can utilize 4 hours meaningfully, if you can sleep properly, and if you have hunger to eat what you want to eat, I don't think we need more reasons to be physically active and follow fitness.
and I
Rest are
totally
all.
agree with you on the feel good factor. Yes, Captain, go on.
So, I mean, rest is peripheral.
Hmm.
Rest is peripheral, that you may want to take up running, walking, cycling, or whatever when things are fine tomorrow. But as of now, out of 24 hours, when you're struggling to spend time, when you're struggling to keep positive, when you're struggling to eat what you want to eat, when you're struggling to sleep properly, a routine which is something that nobody can take, it's like knowledge. मैं 10 घंटा पढ़ूंगा, कोई मेरे से ले नहीं सकता. I can only share some good things that I have learned about. You can't take it away from me. You can't take away my 30 inches waist. That's mine. I've earned it. So everything that you earn in fitness is purely yours. And it is only and only and only going to help you. It is going to make you more active. It is going to make you more efficient. It is going to give you more time in this life.
Right.
So I'm surprised that we are a society where we have to hard sell insurance to people. You know, क्योंकि हमें लगता है कि बीमारी हमारे लिए नहीं है, हमें नहीं होगी कभी.
That is one of the most important things when it comes to the awareness regarding COVID, that, you know, people think hame nahi hoga, till it actually hits them, and it hits them big time when it's too late. So I think what you said is right, to be meaningfully engaged and to also remain physically fit through all times can save us from a lot of anxiety, whether it's a COVID or any other pandemic that hits us at any point of time. Dr. Jyoti, how important is it to maintain a balance of emotions during these anxious times? And what activities or engagements can one have to achieve that?
I totally agree with Captain. Like I explained well about like physical health and mental health. Okay, now we are only thinking pandemic time. We are not going out. We are only inside. We are like not able to make anything. You can do 20 Surya Namaskar. Like I'm giving example. You can do yoga. Okay, for you, if you want to control your emotions, okay, I'll talk about only general thing. Okay, if we are fighting with like inside the house, just take time, just go inside, sit some time, do meditation, do like check your phone, check your like chatting with your friends. This is a normal thing. Okay, we are only officially using the official words about anxiety, stress, emotions, COVID, so many things. Now I think one like the captain said now, my one of the client, she is a 8 month conceived. She have left hand pain. She went to gynecologist. She met the gynecologist, suggested go for RT-PCR test. She tested positive. She is a 8 month conceived. Just imagine, gynecologist can't do the delivery also. Then what is the treatment now? Then like again 2 days back, after 2 days she went for the test. She tested negative. Okay, now we need to think what can she control, like her like hand pain. She could have do some stretching exercise. See, if you are like 8 month pregnant, it's obviously like you have so many pains, right? Your body need to be like ready for something new.
Right.
Right, this is so many things we need to take. Okay, then about COVID anxiety or emotional management, we all individually having so many different opinion about our emotion. Some people having like mera pati mere se baat nahi kar rahe, that's what I'm feeling depressed. That's not the point. You can channelize yourself. What you can do that time, if you are bored, do something new. If you are like kids is like frustrating, otherwise demanding with you, do something like play some game with them. I think so many like games in we can do the indoor games. We can plan. We need to sit. We need to plan. I think that's how we can manage our emotions, even balance our emotions. That's all. Like we need to think. That's all.
Absolutely. So, Ekta, I would like to know what measures you took for the prevention, what measures you adopted naturally, because you are a great believer of natural products. So, what were the measures, if you could quickly run us through?
Yeah, Seema, if I talk about the measures we took is, as we were already doing the Havan, so we started and we continued it. And also the neem leaves boiled and using that spray, keeping the neem leaves in our, whether we are traveling, in our pockets, in our car, and keeping at homes and while taking baths. So we used such things, and we added the diets in like amla, giloy. So this type of things improved
Okay.
Chavanpraj. So many the home remedies that we used to from our grandparents for the cough and cold.
Right.
So I agree with the captain and Dr. Jyoti that even if there is a, small sneezing, we consider that, oh, it can be the COVID. So that
Right.
fear. So now, during we also faced some cold cough or a feverish type of feelings, sometimes little vomited and something like anything like this. So we just first of all we introspected our symptoms. We checked our symptoms. If there is, we did gargles, steam. So if it is recovered in a day or two, and trust me, whenever we did all these measures, we recovered in a day or two. So because steam and gargles all the time, and I tell you, my brother faced this COVID situation, and he was admitted to the hospital by the authorities. But we
Right.
consulted a lot of doctors during that time, and everybody answered us that if there is any problem, then you go to the hospital. Else you stay at home, take a good diet, enjoy. You can have a walk because we had a safe place. Instead of confining the person to a place, just let them, speak to them. So instead of watching the TV and watching a lot of news, so this type of measures, we worked on mental as well as the physical health. As we said, Dr. Jyoti mentioned that we also received a lot of queries from the family, friends, and a lot of other people's nothing to do at home. Now we are gaining weight all the time. We are eating and eating. So actually, this is not the right scenario. We can do a lot of workouts. And yes, Dr. Jyoti, and that Surya Namaskar, I personally did it. In normal life, I was not getting time for the Surya Namaskar, but during COVID time, I reduced 5 kg using Surya Namaskar. I started from 5 and reached up to 21 in 1 month. And so, our yoga, stretching, you just play the music, go for aerobics and light music, go for yoga, meditations, and all these things help. We
So,
have so many YouTube, yes.
yeah, please go on.
Guided meditations, yes, guided meditations by Art of Living, Sadhguru, lot of things are there. We can do anything at home. Actually, learning starts from home first.
So, as a gist of what you all have told, I think there are many things that we can do to keep ourselves constructively engaged during this rather than panicking about kya hoga. And, like as Captain said, worrying about your loved ones, worrying about your family after you, or how best you can save them. I think the most important thing is, to keep our mind focused on what we need to do, like how even Dr. Jyoti said. The need of the hour is what you need to do if you're infected with COVID. Or if you're not infected with COVID, then how to save yourself? What are the preventive measures? Rather than focusing on, all sort of jargon of news and keeping ourselves updated with what is the latest. Yes, you can keep yourself updated, but only to a point of just having knowledge, and I guess not getting so overworked about it or panicked about it. But there's another thing that today is actually taking over after COVID. Even once the person is recovering from COVID, there's something else that's taken over India. Mucormycosis is a fast devouring life. As a responsible citizen and above that, a human, you have been passionate about the awareness on COVID vaccination drives and especially mucormycosis, Captain. So I would like to play a short video on mucormycosis so that our audience can also just get an insight if in case they haven't. And post that, I would like you to enlighten us on the subject with whatever insights you have, since you've been very passionately following that. So could we have the video, please? Kanishka? Audio. The audio isn't, is it audible to the others?
No.
No, okay.
It's not audible,
No,
Seema?
it's not audible. It's not audible, dear.
Okay, I'm going to play it again.
Sinonasal,
Yeah.
Now is it?
orbital,
Yes.
and
Now it's up.
cerebral. These are three types of mucormycosis or black fungus. Their cases are currently on the rise in India. All three types are equally dangerous. But what exactly is this infection? The Center for Disease Control and Prevention defines black fungus as a serious but rare fungal infection caused by a group of molds which live freely in the environment, particularly in soil, wet surfaces, and decaying organic matter. People get infected when they come in contact with these fungal molds. For example, the lung or sinus forms of black fungus occur after someone breathes in the spores. In pre-COVID times, this infection was quite rare around the world, but since the pandemic, cases have increased due to complications related to the virus. In India, only a few cases were reported in New Delhi last year, but now the new virus mutant is driving a surge in black fungus infections across the country. According to the Indian Council of Medical Research, 4 kinds of people: those who used steroids during their COVID-19 treatment, thus lowering their immunity; those who had prolonged stays at hospital ICUs and are yet to recover; those with diabetes or a history of kidney and heart failure; and those who are on medication for major health problems that reduces their ability to fight pathogens. The infection typically starts growing from the nose, upper jaw, and travels to the brain. Experts say once it reaches the brain, it's almost a death sentence. So if you are experiencing any of these symptoms, see a doctor at the earliest. Pain under the eyes, one-sided facial swelling, nasal or sinus congestion, black lesions on nasal bridge, stuffy or bleeding nose, toothache or loosening teeth, and partial loss of vision. How do you protect yourself from such an infection? Experts advise the following steps. Wear a mask at all times. Wear shoes, long trousers, and preferably gloves if you step out into a park or for gardening, and maintain personal hygiene, including a thorough scrub bath.
Seema, you're on mute.
Sorry there. Yes. Over to you, Captain. Your views on mucormycosis, since it's the next in queue after COVID. After COVID, recovering from COVID, next what? And it has proved to be fatal with many people.
Yeah.
Yes.
So I've been, as I said, I tried doing my bit to the extent it was possible. And to be able to do that, I thought I should make use of my social media reach. And I reached out to doctors. It was a request to all the doctors on my platform, and if they can come together and help us free of cost to humanity. So there's a group of 12 doctors, and we did a talk on mucormycosis about 3 days back. We had dentists, we had eye care specialists, we had pediatric guy, we had a general physician, we had someone who deals in anesthesia. So the point I'm trying to make here is we had people from all the fields possible, to take care of certain aspects of mucormycosis. I'm not a medical expert, but what I have learned from that meeting is it is something everybody who's immunocompromised, this word in itself is self-explanatory. जिसका भी immune weak हो जाता है, ज़्यादा weak हो जाता है, they are the most susceptible people. They are the most probable people to get mucormycosis. right? Anyone who's going through COVID ailment, anybody who's hospitalized, anyone who's been put on oxygen, anybody who's been given steroids, I mean, it has somewhere killed your immunity.
Right.
And that is where these people are the most vulnerable people to get mucormycosis. It is not something which never existed. Even the video suggested that it is something that used to be found very rarely in people. And in fact, if I have a story on my Instagram today that there is a guy who's been detected with black fungus, yellow fungus, white fungus without COVID history, right? So again, diabetic people are most prone to it. People who've been put on steroids are most prone to it. The positivity that I want to drive here is we are too curious to pick up these numbers, which are a probability once in a million.
Right.
So a normal person who's been cured home, just jo home isolation mein, almost 80% of the people, 90% of the people who suffered corona,
Right.
they got okay on their own in home isolation.
Right.
They need not.
Just to interrupt for a second, Captain, Dr. Jyoti would like to leave us. She has an emergency call.
Oh.
So, Dr. Jyoti, you might take a leave. Thank you for
Thank you so
being with
much.
us, and thanks
all.
for your insight.
Nice to talking to you all. Nice to meet you, Captain Sir.
Thank you, ma'am.
I'm glad to hear.
Thank you, ma'am. Thank you so
Thank
much.
you, Jyoti. Thank you so much. Yes, Captain.
Yes, so the point that I'm trying to make here is that not everybody is supposed to be so fearful of this mucormycosis. Yes, I mean, we have a population. Of our population, certain people are COVID affected.
Right.
Now, of that affected population, certain percentile can get mucormycosis.
Right.
But the fear is much larger. It does not mean that we will not take care of it. I think what we need to take care of is like the COVID behavior protocols, we have to take care of everything which allows external body entering our body, external molds entering our body. It could go through your skin, it could go through your nose, mouth. These are the most obvious means where it can get into your body. So you have to take care of yourself. You have to make certain dietary changes. Again, health and fitness. I think one thing that has prevented maximum number of people of diabetics is fitness. This is the most inversely proportionate relationship that you would realize. If you are a fitness freak, you are very unlikely to be a diabetic person.
Right.
So all of this somewhere comes back to this overall scenario that your fitness plays a very, very important role, and it is just for you. आपका शरीर है, आपकी body है, आपकी fitness है. If you are fit, you are probably taken care from many aspects. So I think that's my take on mucormycosis. Beyond that, I wouldn't want to talk anything on the symptoms. I wouldn't want to suggest any medical terminology. What I would want to suggest here is, which is not very many people following, we tend to delay and self-test ourselves basis the past 20, 25, 30, 35, 40, 55, whatever our age is. And we feel that we know our body. And every symptom of illness, we justify it with कल सोया कम था इसलिए आंख में जलन हो रही होगी, मोबाइल ज्यादा देर देख लिया ये करके जलन हो रही होगी, मीठा कुछ खा लिया इसलिए दांत में दर्द हो रहा होगा. We have a reason for every problem that we have and we spend time in that.
Absolutely.
This is not that time. We are not going through that time. We have very little scope of self introspection of what is wrong with you. It happened with Corona also. Trust me.
Absolutely.
The day you were not okay, you thought, let's see for a couple of days if it persists or not. 2 days gone. When it persists, then you go for your test.
Absolutely.
You still carry on with your routine till the test is positive. 5 days gone. And then you realize that you've given to at least 100 people in the last 5 days because now you are positive.
Absolutely.
So the mantra is, the first symptom that you get, if it is COVID fear, isolate yourself and then do anything and everything that you want to do. If it is mucormycosis, call a doctor immediately.
Right.
One universal truth is, you can't know everything. And another universal truth about getting better at your unawareness is, seek for help. Madad mangiye.
Absolutely. Absolutely. Captain, I would like to reiterate on whatever you said. I mean, having said that, yes, mucormycosis is not as bad as what it may seem to be, with very few percentile actually being affected, both post-COVID recovery or non-COVID. The most important thing to highlight here is both diabetics, especially are the ones that targeted with mucormycosis, and immunocompromised, whether with steroids or any other drugs. So I think for the general public to be aware is, even if you have to be saved from COVID or mucormycosis, they have to remember a simple terms of SMS where you use your soap to wash your hands frequently, double mask yourself with a medical or a clinical mask inside, a surgical mask inside, with another over a cloth or an N95 on the outside. And even more better for the people who are more immunocompromised to use a triple mask nowadays, because mucormycosis can also spread through air, can spread through your vegetables, through soil. So the better handling of your vegetables or anything that you're doing while gardening or anything like that, anywhere, the breads, what you store in your refrigerators can also be fresh, and make sure that, when you handle, you can wash your hands after that. Sanitize yourself often. So these kind of measures can always save you from that. And I think no one needs to be so panicked about what is going to happen. Keeping a calm mind can help you be better focused on how to tackle, if at all anyone gets infected with COVID, than, running helter-skelter. Getting yourself updated with knowledge should be about what are the facilities that you can avail, if at all you or anyone around you, your neighbors, your friends, your relatives, how to get help to them. I think that knowledge should be more important than what is it that COVID has to do and what are the variants of COVID. Leave that to the medical facility people or the medicos to deal with what are the variants. And people also need to have faith in the medical fraternity, in the researchers, that they're out there to save humanity. No one here wants people to suffer with a blood clot or any other side effects. They're all here to create vaccines only to save humanity. And they're not God. I think, they're all there to try to get the best version of the vaccine. And we all should volunteer for that and trust, the vaccine. It's 1 in a million. Like how I would say that, if you have a white paper, people don't look at the white paper and you just put a dot on it. So it's just that people want to focus on that one dot. It's a very rare case of such events happening, and we should not follow the things that are around from sources which are not researched well, that vaccination can cause a lot of side effects. No, there are, please go and check with your doctors, and they're the best ones to guide you. And I think people should get vaccinated. Whichever vaccine you choose is ultimately your choice. But I think vaccination can prevent our country from, further spreading this disease. And that way we can all achieve herd immunity over the period of time. So it's better to go out with a shield, than just going out into the war field barehanded. So this is my take on this. I would like you all to share your giveaways or your takeaways for the entire public, how they can maintain awareness with this throughout this crisis. Any one-liners from all of you?
Hi, Seema, I'd like to go first.
Yes.
So, my major takeaway from my own experience has been that you should not give up on yourself. Uh, Keep trying, keep having that positive attitude, and keep up the spirit, because if you are strong and you exude that confidence that you are going to overcome this tough time, then everyone else around you is going to get inspired as well, and thereby your circle of influence will expand. And I agree with all the speakers who have discussed this topic, that we should always look out for a authentic, reliable source for information, rather than just looking at sensational news, or forwards sent by random people. So look for authentic information, and keep faith. That's what is going to help you sail through it all. Thank you.
Thank you, Kanishka. Yes, Captain.
Um, I think I would want to suggest that let's engage ourselves meaningfully. And when I say meaningfully, it'll help you not spend too much time around negativity, because now things have improved. I don't think the situation in South is too good as of now, but there is not too much available outside. So if you are meaningfully engaged in your own environment with your own people, I think nothing better than that.
Over to you.
I would like to say that uh, humans have the huge capability of adjusting to the situations. Whatever the situations are, God has given us this capability to adjust and find out our ways. So, this is the time to find your ways. First of all, look inside, make yourself happy, and then healthy, and just go and help the others. Stay together. This is a time to stay together, build the strong relationships, bonding with the people, not only the family, friends, just be happy and smile to everybody. It's time to stay together strongly and help each other.
Thank you all. I would like to conclude with saying that Captain is out on his mission with awareness with regarding to COVID. So people, whoever would like to take part in his campaign against fighting COVID in the right ways and getting awareness on COVID in the right ways, can connect with him on his Insta profile, which he engages in every day to educate the masses. That's one. And people can also associate with Ekta, who is also driving towards a greener environment, where today you have, air is sold. If you're talking about oxygen, so why can't we have a cleaner environment with Go Green and adopt so many natural things as well, small lifestyle changes, so that can actually work out in a long way on our health as well. So I think another appeal to the masses would be like, spread positivity rather than fear. Take the panic out of you. If you're using all the preventive measures, then I don't think you need to fear anything. A strong mind and a strong body can fight COVID, can fight mucormycosis at any time. Be there for everybody around you. That itself is, the greatest thing that you could do for humanity. And I think we are all in it together. It's a global fight against this. So once you know that you're together and you're not alone, that itself is like half the battle won. Won't you agree with me?
Yeah,
So
I
I
agree.
think we're all in it together, and we can move this forward. So my appeal to the public is stay tuned on our platform, on our individual platforms, as well as we would continue this COVID awareness and the positivity towards it till it leaves our entire humanity. So thank you all for joining. Thank you so much, Captain. Thank you, Ekta. Thank you, Kanishka. And thank you, Tamil sir, for giving us such a platform. And one small thank you to Mr. Praveen for making the video apt for today's session. So see you all. Good night and have a great Monday. And stay fit, stay healthy. Thank you all. Good night.
Thank you.
Thank
Thank you so
you.
much.
Thank you so much.
Thank you.